Our final presentation with reflections on future challenges and opportunities in a post-COVID world will come from Dr. Serge Makolo, current director of the IMCK and chief director of the Chikaji Health Zone, and former medical director and chief medical officer of the Bilomba Health Zone. He has a medical degree from the University of Lubumbashi, a diploma as specialist in public health from the University of Lubumbashi, and a certificate in scientific research from the Free University of Brussels and the Catholic University of Louvain. He was born and raised in Kinshasa, and he is married to Mrs. Bertha Chilomba and is father of 5 children.
Hi everyone, my name is Dr. Serge Makolo. I'm from the Democratic Republic of Congo. I live in Kananga. I'm the director of IMCK, which means the Christian Medical Institute of Kasai. It includes 4 main departments: the medical department with a hospital and a polyclinic, the education department with 2 nursing schools, the community health department, and the hydroelectricity department with a dam. My presentation will focus on 3 points. First, on our healthcare system profile before COVID-19, then on the opportunities of our healthcare system after COVID-19, finally, on the challenges of our healthcare system after COVID-19. To begin, let's look at what our healthcare system was like before COVID-19. I'm going to talk about 2 key aspects: the universal health coverage and the financial protection. Several reports reveal that more than 70% of Congolese lacks access to the essential healthcare services, both in terms of geographical and financial accessibility, especially mothers and children. According to WHO, there is a lack of qualified staff, a lack of medical equipment and materials. For example, in my province, we don't have a surgeon. In my country, before COVID pandemics appears, we had only 50 resuscitation beds, while in Algeria, they had more than 2,000. We had only 10 respirators, while in Morocco, they had more than 3,000. Evidence shows that in DRC, the majority of the staff have symptoms of burnout. Their mindset and behaviors are affected. The government resources allocated to the healthcare organization is about 10%, and most of Congolese have to pay around 10% of their household budget in healthcare, so that the catastrophic health expenditure is estimated between $20 and $40. In this context of gap in health service coverage, the COVID-19 appears. Like a storm, it sweeps everything in its path. People get ill and die. Schools close. Employees lose their jobs. The healthcare system is under pressure. COVID-19 exposes our healthcare system weaknesses. There are lessons learned from this pandemic of COVID-19. It's very easy to lose the hope over these negative events. This is the dark side of COVID-19. But let me tell you something. Every coin has two faces. And also, crisis is often what drives successful change. I mean that at every tragic situation, it's very important to analyze the situation for a better future. That's what I would like to call the upside of COVID-19, the opportunities of COVID-19, or the bright side of COVID-19. We have to ask to each other this question: what worked and what didn't work? Today, we are able to manufacture masks, to manufacture respirators. We can meet virtually. Like a mirror, the COVID-19 pandemic opened our eyes, not only to show us our weaknesses, but also to discover our abilities. We are able to teach online. Behind these opportunities, there are many challenges. How can we improve our healthcare systems as long as the majority of Congolese cannot access to the basic health primary cares? How is it possible to improve our healthcare system when we have no surgeon? How is it possible to improve our healthcare system when we have no qualified member, when we have a lack of medical equipment and materials? But let me tell you two things. There is a light behind the COVID-19 pandemic tunnel. And also, just because something is difficult, it doesn't mean it's impossible to do it. God bless us. Thank you.